Hi, my name is Liis Teene. I'm the Director of Clinical Trials and Health Economics at MolecuLight. Today I'm presenting the poster entitled Health Economics of Fluorescence Imaging, Realize Cost Savings with Appropriate Treatment of Bacteria in Chronic Wounds. Diagnostic errors are very costly. Specifically in the treatment of chronic wounds, the cost of infection is incremental. We know that when appropriate diagnostics are used, that treatment gets better and reduces costs. For this model, we use three pieces of information. The first being a clinical trial in which we imaged 350 chronic wounds across 14 clinical sites with 20 clinicians. In this clinical trial, the clinicians compared the diagnostic accuracy of clinical signs and symptoms to identify the presence of infection in chronic wounds. They then used a bacterial fluorescence imaging device called MolecuLight IX, which uses violet light to excite bacterial presence in chronic wounds. The diagnosis of infection was made using the standard of care, clinical signs and symptoms, and also fluorescence imaging. And a gold standard biopsy was used to determine the diagnostic accuracy of both methods. We then used CMS data from 2014 to model the cost of wound care in an example institution. You can see here in the assumptions, we can see that the annual cost of a wound without infection is just over $2,100. However, when a wound is infected, the costs increase dramatically. The incremental cost of an infection is just under $1,500. In an example institution where we look at 40 patients per day, or 40 patients per day are imaged, where clinic is run 3 days per week and 48 weeks out of the year, assuming an incidence of infection of 32% and an even distribution of wound etiologies, you can see that the cost of wound care at this example institution sums up to approximately $1.3 million. In our modeling assumptions, we've used the price of the device and the use of a dark drape, which may be required to create a dark environment in which to perform fluorescence imaging. And we assume that 90% of wounds would be imaged, and with 50% of them using the dark drape. Using the data from the 350 patient clinical trial, we know that the increase in positive patients detected by MolecuLight was increased by 46%. This means that these patients were diagnosed with infections that would not have been diagnosed with clinical signs and symptoms alone. Knowing that an accurate diagnosis and appropriate treatment can alleviate the cost of infection, the estimated cost savings is shown here. In addition, there was increased confidence when clinical signs and symptoms were negative, and this prevented overtreatment. In these patients, when clinical signs and symptoms was unclear with respect to the presence of infections, in some instances, clinicians prescribed antibiotics. When the fluorescence imaging was used, these patients were determined to be negative for fluorescence, and these were later confirmed by biopsy. 4% of patients had this occurrence, meaning that the use of fluorescence imaging saved the expensive treatment of infection, which was not warranted in these patients. The total cost savings when appropriate diagnosis is made with fluorescence imaging is shown in the total cost savings here, $355,000 for this example institution. Now, when considering the cost of the device and the consumables, you can see here that based on the total cost of wound care at this example institution, the percent total of savings that are required to pay for the MolecuLight device and consumables is 9%. However, if this is ubiquitously used across the institution, the annual cost savings for the institution are approximately 25% per year. We know that objective diagnostic evidence leads to better treatment of wounds and therefore closes wounds faster and mitigates the requirement for more expensive therapies. The MolecuLight IX fluorescence imaging device is a diagnostic tool that enables this cost savings on an institution-wide basis.